very often we appear on a platform together, and very often we find it quite difficult to find areas of disagreement. And that, I think, reflects a broader truth that between the major parties in British politics, actually there's a very broad agreement about what the objectives of health policy are. And it's one of the less attractive aspects of British politics that in the run-up to a general election, there are very powerful incentives for the parties to exaggerate their disagreements rather than focus on the areas of agreement and the longer-term objectives of transforming healthcare in order better to deliver the shared objective of equitable access to high-quality healthcare. It's inconceivable in the modern world that you can deliver the objectives of the best quality care for patients and fair access to that care without fully employing information technology in its broadest sense. That's partly about passing information around the system, partly it's about enabling people to be partners in looking after themselves so that they can see the results of tests and so forth real time. That's an important element of it. And also digital technology, of course, has an important role to play, not just in passing patient notes, that kind of information, but in joining up the different aspects of the healthcare system, whether it's in the community or in the social care system, social housing, and in the acute sector. The progress has been disappointing. There have been a number of very well publicised failures of the implementation of information systems of one sort and another around the health and care system. And I think it's very important that those failures aren't used as an excuse for not continuing to push for the use of modern information technology, because wherever it's used in the world and used properly, it has a transformative potential in the experience of health and care by patients. And that's in the end what matters. It isn't that you've got a gleaming new computer, it is that the service delivered to an individual is better than it could be if you didn't use information technology properly.